what are your low points and high points as far as the business? What are those times? What are those things? And I want to emphasize low points because and it's not to be depressing. It's because there are people out there who are doing it and it doesn't seem like it seems on TV. You know, it's not so easy. And when you're actually out there, there's some scary moments that we go through from a business standpoint. And then there are those exhilarating moments that, so, I mean, let's go ahead and just start. Lisa, what was...
Low point. I'm like the perpetual optimist, so I'm going to have to dig for a low point. I know what it was. So starting in 2000, I announced it in 2011. Every time I talked about it, I got this look like when a dog is confused and it goes like this to you. Like, what do you mean? And so going into it, when I sent out my letters, everybody who's started knows sending out your letters is terrifying. I was like, oh my gosh, we're going to have a barrage of people. We're going to have a waiting list. Like, we got to get ready for this. And like 200 people signed up out of like how many thousand. And so it was like, at first I felt like, wow, so my patients kind of think I suck, I guess. But then you have to realize it had nothing to do with that. It's that they didn't get it. They didn't know what the model was. And so one of you boys said, it's not about marketing, it's about teaching and educating. So if all of your patients don't sign up from your letter, don't freak out. And it doesn't mean you're a bad doctor. They're going to come to you. So that's my one little negative. Now it's your turn.
No, I probably had similar to the same negative. I really expected more people to come over. And there were actually a lot of people that showed up with tears in their eyes saying, I just can't afford that monthly membership fee. And so, and I was pretty reasonable and said, I just can't do this. And I really want to keep you as my doctor. And is there something we can work out? And I said, no, this is kind of the model going forward. And literally there was a New York policeman that was in town, this Irish New York policeman with tears down his eyes saying, you know, I don't want to leave you, doc. That was tough. But he just couldn't see that this was going to benefit him down the road. And another low point literally was the combined amount of income was less than $100 at one point. Mm-hmm. And that next day checks came in, but oh my gosh, I was just like, oh, what am I gonna do? What can I sell? You know, I mean, it was the type of thing. So it wasn't always that it was just this flow through that. So those are probably the two lowest points that I had.
I guess mine would be similar. My business plan was based on the idea that I wouldn't be profitable till year 3. So that's right about now. And actually, I should have taken my first paycheck this month, but instead I bought a laptop. The financial stress is pretty tremendous, but the flip side is, as physicians, I don't know any, well, there's probably other professions that can sort of hustle and negotiate hourly wages in the dark hours of the evening and the weekend. So right. My advice is, if you're in a situation like me, which is you've got to make this work from scratch, start looking at urgent care, on-site employment clinics, hospice medical directorships, and only accept an hourly wage. And I'll tell you, it needs to be over $100 an hour. They'll start at $85. And anyone's welcome to email me about. But because when you're paid hourly and the system's totally dysfunctional, you're still making money when you're, you know. So my low point, ironically, my low point wasn't really cancer, although it does bring up the, what am I doing? Do I really want to be a doctor? Is this worth it? So that's probably an existential point. But the hard part of the first 3 years is the finances.
Yeah, I will just echoing that after my first year where I actually didn't earn anything, I actually qualified for Medicaid. I mean, it was that hard, and I had 3 kids in college at one point in time. It was a really bad time of life to do it, and it was scary as anything. I mean, it was really hard to be facing all that stuff down and to be looking, you know, every day looking at this balance in my home bank account. Am I going to make my mortgage? My work bank account, am I going to make payroll? And it's just this month by month thing that I never thought I would do. And it's this feeling in the gut of your stomach, yet, you know, it does pay off, but it is hard. When you have those feelings, they are really tough. Actually, just a word for Hint Health, I actually had been with a different billing system ahead of time because they came into existence after I started, and Zach was wanting to convert me over. And I was so scared. I was going to say scared shitless. I guess that's fine. I was. totally absent of shit in me. But because they were going to hit my cash flow. It was like, that's my lifeblood. If switching over all of my patients on this one billing system over to Hint, I was just afraid that I wouldn't have money to pay my mortgage, that I wouldn't have money to pay my staff. And they did an incredible job. Switched me over in 1 month. And again, I could not believe. And then finally Zach was like, Rob, I'll personally guarantee, we'll loan you money if we need to, whatever. And it's like, golly, what great guys. I mean, but really, as far as the professionalism of how they ran and how within a month the cash flow never took a dip down at all. And I think Zach would guarantee any of you guys too.